Have you ever thought about the business side of healthcare? I hadn't, but I was with a group of friends the other day and they were talking about all their degrees. Most of them are graduating. So one girl in specific, she was talking about how excited she was about to start her career and how her degree had prepared her for anything. And so we were all, "What's your degree in?" And she said, "Healthcare administration." We were all confused because, of course, all we've ever seen about healthcare is Grey's Anatomy and what our nursing student friends are doing. So she started explaining, and she's like, "It's this whole other side of healthcare that you never even think about. It's business." And so we were all just so excited to hear about what she was saying. She told us her possibilities were endless. She could start out small and end up being a CEO. And so I was so interested that I went home and I started Googling a bunch of stuff. And so I'd like to share with you today about what healthcare administration is and introduce you to a whole new side of business. First of all, I want to tell you what healthcare administration is. According to explorehealthcareers.org, a healthcare administrator directs the operations of hospitals, health systems, and other types of health organizations. They're responsible for facilities, services, programs, staff, budgeting, etc. Basically, what you think of a business person being like a manager, but you're not stuck in a office. You're more hands-on. You get to meet with patients. You get to interact with everyone that you're with. In a hospital setting, you'd pretty much get to be with around every type of healthcare person. But in smaller businesses, you might have your own office. So you might not see a lot of people as much, but you're still very interactive. Healthcare administrators work hard behind the scenes so everything can run smoothly for all. They help shape policy and lead our nation's health-related organizations in a way that will improve our healthcare systems. Education needed for this is very simple. Most people start out with a bachelor's. Like my friend, she was starting out with a bachelor's. Her plan was to work a few years and then go back to school and get her MBA, which is Master's in Business Administration. And that's how most people start out. They start out with a bachelor's, and that's honestly not a bad thing because it ends up being a quite comfortable salary starting out. She had a few jobs lined up, and she was telling me that her first offer was $60,000, and I was like, I'm about to change my degree because that sounds perfect. But so the starting out salary isn't quite $60,000. It starts at $50,000, and as you get more experience and more training and more education with an MBA, you'll get the salary that you can get is up to $116,000, and it's very rewarding if you didn't catch that. You can take it all the way to $161,000. Oh, did I say that wrong? Okay. $161,000, not 116, according to CareerTrove.org. There are endless possibilities for jobs once you get your MBA, and you can work in a hospital, a medical group, pharmaceutical or biotechnology companies, government policy organizations, and so much more. So you're not just going to be stuck in an office all day or a hospital. You could go anywhere practically. And it all starts with a simple bachelor's degree. It doesn't sound too bad to me. Due to new facilities being built every day, the Federal Bureau of Statistics says that 22% growth rate between 2010 and 2020, which is way more than the 14% of growth of all companies, all occupations. So this career is expanding and is way important. You never think about it, but it's going to be something big, something that we don't think about now, but in a few years it's going to be so big that we're just going to want to all change our careers to it because it helps everyone. It's very important in healthcare. It changes lives of people, and you wouldn't even think of it because it's behind the scenes. Like all healthcare careers, there's plenty of room to advance. You may start out small, but the profession can take you to the top. like my friend who plans on being a CEO one day. I hope I was able to show you a different side of healthcare today. And I really hope if you haven't chosen your career yet to really think about this. I personally, I've been surrounded by healthcare with my family. And I've never just had the desire to be a nurse or a doctor to cut up someone. And so I looked into this and I was like, this is something that I could do. It takes leadership, and I think of myself as a leader sometimes. And, I talk a lot, and that is also required for the job. You have to be very talkative with your not customers, but your clients, all of that. So this job, if you're interested in healthcare at all, but you just don't like blood or any of that, this is something to definitely check out. I hope I helped you understand what healthcare administration is, and I hope I inspired you to look into it.